Okay folks, today I want to talk about hepatitis A virus. Hepatitis A virus, it is a RNA hepatovirus in the picornavirus family. It is a naked capsid, unenveloped, linear, single-stranded, positive sense RNA virus with a cubic symmetry. I have many patients, unfortunately, sadly, I have many patients with this problem, so I want to talk about this problem for a few minutes. Hepatitis A virus, it replicates in the cytoplasm of the intestinal mucosa by using viral RNA polymerase. The virus is transmitted by the fecal-oral route. More than 90% of adult population is seropositive in developing countries. The incubation period averages 30 days. It is followed by viremia and spread to the liver and cause lymphoid cell infiltration. It causes necrosis of liver parenchymal cells, and it also causes proliferation of Kupffer cells. There is no chronic carrier state. Please remember that. That's a very important point. In hepatitis B, hepatitis C, you will see a chronic carrier state. But in hepatitis A, you do not see a chronic carrier state. And there are certain risk factors. People who live in overcrowding, poor sanitation, men who have sex with men, women who have sex with women, in illicit drug users, in travelers from the developing nations visiting developing nations. So these are the risk factors. Symptoms and signs. This can contaminate people up to 10 to 14 days before the symptoms appear. When symptoms appear, you will see different systemic symptoms like fever, malaise, myalgia, arthralgia, easy fatigability, and upper respiratory symptoms, a distaste for smoking, anorexia, nausea, upper quadrant abdominal pain, jaundice, hepatomegaly, liver tenderness, splenomegaly, and patients develop dark urine and clay-colored stools. So these are the common symptoms. How do you diagnose this condition? Basically, when the virus comes into their body, the initial immune response is the development of HAV-specific IgM antibody. So IgM antibodies come first, then they develop IgG antibodies. So the best method for documentation of acute HIV infection is the demonstration of high titers of virus-specific IgM antibody during the acute phase of illness. Then you can also use reverse transcriptase polymerase chain reaction, that is RT-PCR, to detect hepatitis A virus. Amino transferases like ALT and AST and bilirubin level, they can go up. And then the treatment. There is no specific treatment for hepatitis A virus. Supportive measures include adequate nutrition, rest, serum immune globulin, and it provides temporary protection if given before or during the incubation period. And the good news is there is a vaccine. You can use an effective inactivated hepatitis A vaccine. You give in 2 doses, 6 to 12 months apart. So if you give 1 dose today, give after 6 months the second dose. And it is active in children from 1 year and also in adults. So hepatitis A vaccine is important in risk in everybody actually. It's good to give hepatitis A vaccine because all of us will be exposed to the risk factors. And the prognosis, there is good news. Almost all cases, 90% of hepatitis A virus are self-limiting. And the other good news is hepatitis A does not cause chronic liver disease. So that's an important point. And then the IgG antibody is actually protective. So hopefully those points will help you when you study about hepatitis A virus.